Good afternoon again. This is Dr. Bertolino, the head doc, Smooth Solutions. I'm putting up another reel today on an interesting topic that has become now more well known. We're going to talk about exosomes and the frequently asked questions that I get when people ask me about certain procedures and why we employ exosomes with them. So one of the first questions that people ask is, well, what are they, right? I mean, nobody's really heard about them until the last few years. But they are released from your cells, okay, that serve in a way to communicate between cells. So they're cell signalers and they're also cell communicators. Very interesting. An exosome, an exosomal vessel, which is like a little bubble that comes out of a cell, is about 1/1000th the size of a cell. So imagine how small that is. But what these little critters can do when it comes to health, well-being, and aesthetics. So what do they do? Well, they transfer, it's a little technical, they transfer proteins, lipids, and genetic material like messenger RNA. Okay, ever since COVID, anybody mentions messenger RNA, they get a little nervous. Well, messenger RNA is not a bad thing. And when you can message these proteins, lipids, and genetic material to another cell, you can get a response. So how do they function? What did they do? What did they function on? Well, in the aesthetic community, it's obviously about skin. It's about hair. In the sexual wellness community, it's about blood flow, whether it's a woman or a man. It's about producing angiogenesis, the creation of new blood flow. So with respects to skin, it's collagen production, elastin production. With respects to hair, it's thickening and responding to the follicle that is not being prompted anymore as it gets older. So people always ask the question, well, what's the difference between stem cells and exosomes, and should you use them interchangeably? Well, it's a bigger topic, and it becomes a little bit of a problem when you're mentioning stem cells these days. The big difference why you can use exosomes is a stem cell is a living cell, okay, that carries a higher risk of an immune reaction, all right? And that can be a problem in anything you do. So one has to be careful. Not an exosome. An exosome is not alive. It's not a living entity. It can't replicate. It can't mutate. So there are no cellular mutations, making it a very safe product to use, either topically or injectably. So we use them with respects to skin topically after microneedling. We like using it with certain procedures like IPL, Silfirm X, plain microneedling, and we use them topically so they absorb into the upper layer of the skin and therefore help your look or whatever problem you're trying to eradicate. We like using them in hair because of how they signal the hair follicle to become thicker and also create angiogenesis in the scalp. That helps blood supply, which helps your hair. Your hair gets great blood supply back here, but as you get older, it's not so great here. So we have to irrigate it. How do we irrigate it? We promote blood flow. How do we promote blood flow? Procedures we do, and adding exosomes to help those procedures. What about sexual wellness? What about erectile dysfunction? What about anorgasmia in women? Exosomes have been shown to promote angiogenesis. And when it comes to sexual wellness, it's all about blood flow in both the man and the woman. So exosomes regulate circulation. So they're very important in a number of ways. Never talked about this in regular medicine when I was in practice, but wasn't talked about at all, probably still isn't talked about. So today we have two ways to administer these products. We can do a human version with this product right here. That product gets its exosomes from the umbilical cord. And it is a human-derived thing. Sometimes that makes people nervous, but it works very nicely. It's very safe. It's approved. If that bothers people, we have two ways to do it. Plant-derived, with derive for hair, and exoe for skin. So we give people the choice if they have a problem, and we recommend both and use both in our different packages and procedures. So we wanted you to understand and not be afraid today about exosomes, where they come from, what they do. This is all part of science now. It's getting better. There'll be more to talk about in times to come. So if you have questions about this topic or what we do with regards to it, we suggest you give us a call, like I always say, 716-633-6100, smoothsolutionsmed.com. I'm the doctor. I'm the head doctor. And I thank you for listening today. Have a wonderful afternoon.